Hi, good afternoon. My name is Tiffany Powers. I'm a certified lactation counselor and a certified pediatric nurse practitioner with Bonsacor Pediatrics. I work out of our Bonsacor Pediatrics of Mechanicsville and Hanover Pediatrics offices. And I'm here to talk to you about breastfeeding. This week is World Breastfeeding Week, so we're very excited to talk about this. The World Health Organization has World Breastfeeding Week always the first week of August. So we're excited to promote the skill of breastfeeding and think about the health of our young babies. The World Health Organization really promotes exclusive breastfeeding until 6 months. And then we introduce some complementary foods and solids, and they really like breastfeeding up until 2 years of age. The World Health Organization looks at colostrum, which is that first bit of breast milk after the baby is born, as the baby's first vaccine. So you can imagine how important and how nutritious that is. But I want to talk to you today about some topics of breastfeeding. I want to keep it very basic. Breastfeeding can be very complicated. It's amazing what our body can do to produce breast milk. But I just want to talk to you today about why we breastfeed, why it's good to breastfeed, some tips that will help you with breastfeeding, hopefully, make your sessions more successful. Also want to talk about how important it is to have a support team around you when you're doing breastfeeding. And, just finish up with any questions that you might have. So why do we breastfeed? Many of us that have been moms know that it's good. We've been taught that our whole life. But there are many research studies out there and facts as to why we breastfeed and why it's the best thing for our babies. We know that it will decrease the chance of ear infections, other viral infections. It's better for our stomachs, for the baby's stomachs. It's easier on the stomachs. You have less GI upset. There's also been some research studies that show it's better for skin and eczema. Again, it's also good for the moms. We know that breastfeeding moms have a lower risk of breast cancers and ovarian cancers. It also distributes fat a little bit differently, so those breastfed moms can return to those bodies a little bit quicker. And there's also a special bond between the mom and the babies that are breastfed that no one can really take away. They really push to get skin to skin and to latch within an hour of the baby's delivery. So it's very important, and a lot of local hospital systems are really pushing for that initiative. So those of you that have had babies recently or thinking about it, I hope that that happens for you. Another reason that it's good for breastfeeding is it's cheaper. You have all the supply that you need. That's what your body is there for. You have all the equipment between you and the baby. There's no mixing of formula, mixing of bottles. There's no forgetting your milk. It's there with you at all times. So that's another key piece to that. Another thing I wanted to talk about, though, is breastfeeding can be difficult, and we recognize that. Those of us that are providers, pediatricians, local counselors and consultants know that it's difficult. And we hope that you'll be patient and take some of these skills and understand that breastfeeding itself is a skill. I think it's a little bit like riding a bike. You're going to have those times where you get up and things are looking great and you're riding along, and then there's going to be times where you fall over and you have kind of some bad days. So we just hope that you're patient. There's research to show that a lot of moms within the days of day 3 through 7 years of age of the baby often give up, and they will introduce a bottle. And we're just really hoping to promote your persistence and your patience. Let us in the community help you, support you. That's what we're here to do. So just want you to know that it is difficult. It can be difficult, but all women can breastfeed and most all babies can breastfeed. So it's important to know that. Breastfed babies are fed very often, usually 10 to 12 times a day. That can be every hour and a half to 2 hours. So you're feeding that baby often. So it is difficult at times, but we want you to know that, or I want you to know that I'm here to support you. So there are other pieces to the puzzle of breastfeeding. There's things that mom has to do, things that baby has to do. But before you can even go to breast, it's very important to look at the feeding cues of your babies. And some of them are very subtle, so they're easy to miss. So I just wanted to mention a few of them to you. Babies often feed better when they're in this quiet alert state when you start that process. And what that means is the baby is just starting to wake up. If there's one key point that I want you to take away today, I want you to understand that a crying baby is a very late feeding cue for these babies. So if your baby is crying and your baby is irritable, you've almost missed your opportunity to get onto the breast and to have a really good session. So I just wanted to mention that. There is one thing that babies do when they're in that quiet alert state that sometimes we can miss, but if you pick up on it, it's really a good time to start your feed. Babies, when they're asleep and their eyelids are closed, they do these rapid eye movements. And if you've ever looked at your baby and kind of noticed that, and you know it's been about an hour and a half, maybe an hour and 45 minutes since they've last eaten, take a look at your baby and see if they're making those movements. And if they are, that is a really good time to put that baby to breast, or at least to start the process. When they move into more of an active alert state, that's when they are lip smacking, they're putting their fists in their mouth. Some of us have talked about that they're rooting, they're turning their heads and kind of looking like they're ready to eat. That's another good time to start the process. But if that baby is already crying or very irritable, that's a time that could be difficult to get the baby to the breast. So I just wanted to mention those little cues. The feeding cues are very, very important. So take a look at your baby. If the baby's due to eat soon, see if they're making some of these cues and go ahead and start the process. Another good thing with breastfeeding is to make sure that your environment is calm. Babies can sense anxiety, they can sense stress. So especially in these early stages of breastfeeding, it's very important to give your baby as best of environment as you can. It usually takes a good 3 to 4 weeks, sometimes up to 6 weeks, to really establish breastfeeding. So it's very important in the beginning to make sure that you keep your environment calm. Maybe use some guided imagery, some music while you're nursing to see if that will help with your breastfeeding sessions. Babies also breastfeed better when they're skin to skin. They love to be skin to skin. So if you're able to keep your baby just in a diaper only when you're putting them to breast, that's always going to be a better option as well. So you've noticed your feeding cues and now you're ready. I wanted to talk a little bit about what a latch looks like. And when I talk about a good latch, I'm talking about the time that the baby is going to the mom's breast. And there are key things that we look for when you come to a counseling session or your pediatrician or your provider looks for. One of the things is that you really need to make sure that your baby's nose goes to nipple. And when the baby does that, the baby will then lean back and start to open his or her mouth. It's a little bit difficult to describe this. It's better to visualize it. So I just want to say that if you are having a little issues with a latch, that you make sure you see somebody and let them observe and visualize and see if they can help you if there's some issues. I also want to mention that breastfeeding shouldn't be painful. I know a lot of us as moms, we just feel like we just endure the pain. But if you're sitting there nursing your baby and it's painful, there is something that needs to be corrected. So I just want to make sure that nobody's out there going through tears and pain during this breastfeeding time, but instead getting help and making sure that we can correct what might be wrong so that you can have a nice experience with breastfeeding. So we put the baby nose to nipple and the baby is kind of leaned back. The baby's going to open his or her mouth really wide. That's called a gape is what we call that. At that point, you're going to put that baby to breast. And you really want to make sure that the mouth is nice and wide and that it's covering most of your areola. So when you're looking down and your baby is on your breast, you want to make sure that you only see a little bit of the top of the areola. If it's a really shallow latch and they're just onto your nipple, they may be getting breast milk, most likely they will, but it's going to end up being sore for you and they're not going to empty you like they should. So I just want to make sure that that point is made. There's another thing that you can do when your baby is nursing to make sure that it's a good latch, and that's watching his or her jaw movement. There is a proper jaw movement that when they're sucking, the movement will go all the way from the mouth back to the ear. And you can see that. If it's a very shallow suck, it's just not going to empty you like they need to, and then you're going to end up with some sore nipples. So I just want to make sure that those couple of things, there's so much more to a latch than just that. So I want to say that if you are having pain right now, or you've had pain in the past, that you seek some help. You see a counselor, you come see me, you see your pediatrician or your provider, and you talk about that so you can correct it early. We do like to see you early on in the process of breastfeeding to make sure that we can correct things that may not be wrong, but might just need a little bit of readjustment. If you wait too late in the game, sometimes we've missed a little window. So please seek help from somebody early on if you're having those issues. And for those of you that have not started breastfeeding, just think about those couple of things. So I want to also talk about why, we've established a good latch and why people often stop breastfeeding. One of the things that we like as moms is to know what our babies are getting. We are concerned about whether our babies are growing correctly and are they getting enough at the breast. So many of us want to go to a bottle so that we can see a number. We know that our baby's getting 1 or 2 ounces. We can write it down. We can put it in our phones on an app, and we know and we feel comfortable that they're getting what they need. But I really want to stress today that you don't need to do that. That there are your provider, your pediatrician, your counselor, whoever's working with you is going to make sure that that baby is growing and developing appropriately. And there's certain signs that the baby's going to tell you and show you that they are getting enough at the breast. They're going to be what we call satiated at the end of a nursing session, meaning they're going to be very relaxed. Their shoulders are going to be relaxed. They're going to look full. If you pop the baby off the breast or the baby comes off the breast and they're still crying or irritable, then most likely they need more, they need another session. So you would just put them onto the other breast. But if they look really relaxed and very full, then most likely that session was a good one. If your latch is good and you've done a couple of the other tips that we've talked about and the baby's showing those signs, then most likely he or she got what they needed at the breast. Our babies only need a certain amount of volume, and that's where your doctor or your nurse practitioner or whoever you go to is going to help you understand that and going to make sure that the baby is getting enough to eat. Another key point I want to bring out is that the baby is going to guide your supply. And what I mean by that is that that baby is going to take, if everything is working and we've established your latch and things are working well, then that baby is going to determine how much supply he or she needs. Meaning at the breast, if they're full after an ounce or an ounce and a half, they are going to come off the breast and they're going to show you those signs that they're full. What happens sometimes is that we then will take the baby off the breast and then we may initiate pumping or some way to increase our supply. But the concern there is if you are building too much of supply and your baby is not emptying you, you're going to get engorged. So there's really no need to introduce a pump early on in the process. The baby is going to determine how much he or she needs, which is then going to determine your body's supply. It's a supply and demand. So if you are feeding your baby at the breast and then pumping, you may be telling your body that you need to produce more milk than what you really need. And also, as the baby gets bigger and is taking more from your breast, your body is going to make more. So I just really wanted to stress, let the baby guide your supply. Let the baby determine how much he or she needs to drink and grow and develop appropriately. And your body is going to provide that for that baby. So just really wanted to make sure that that you guys understand that. And if there's any point of this that you're concerned, that's where your pediatrician or your provider comes in. You can do weight evaluations and you can just make sure that the baby is getting enough at the breast. But that's where we come in to help you. So before you initiate a bottle or even pumping, make sure it's the right thing and it's the right thing for the baby. Another thing I wanted to kind of talk about was how important your support team is to make a breastfeeding session successful. There's a lot that has to happen here. Like I mentioned, it's a skill. It's not just something that often happens and everything's perfect. There's a lot of things that have to go into play. You need the mom needs to do her part, and the baby needs to do his or her part. But your team around you, your support team, has a very vital role in this. And I want to make sure that everyone understands that, and that you're able to tell your family that, or your support team, whoever they may be. Your partners, your dads, your family members, your friends, they can do so many things for you after your breastfeeding session, and to make sure that you're successful. They can take the baby, put the baby skin to skin, especially for our dads, the baby and our partners, the babies love skin to skin. So take the baby away, let you get some rest, and put the baby skin to skin. They can also make sure that you are well hydrated, bring you food, bring you supplies that you need, make sure you get your rest. So there's such a vital role in your support team. And I just wanted to make sure that that was clear, and that we understand how important a support team is to making breastfeeding successful. Those were the key things that I wanted to bring up today. Like I said, I wanted to keep it very basic, but I am certainly available for any questions that you guys might have. I'm available by phone. I'm available for an appointment. But I just really wanted to bring up some basic key points, and I hope those were helpful for you today. This is World Breastfeeding Week. We're very excited to celebrate that. I hope that those of you that are breastfeeding currently, or thinking about breastfeeding, or you've breastfed in the past, that I want you to know I'm proud of you. I want you to keep up the good work. And if I can be of any help to you, I hope that you will reach out.